Good morning, everybody. This is Donna Nauman, nurse practitioner, and I am here today with Dr. Z. She's from the Radiance. Hi. She's from the Radiance Ketamine Clinic. So I'm bringing providers to St. Louis patients so that patients and providers can begin to meet each other. I feel like there's a very disconnect between Western medicine and all the things that are outside the box that can really help people heal. So I'm going to interview Dr. Z today, actually Dr. Thomas as well. And she's going to be talking to us about depression, anxiety, PTSD, and all the different ways that ketamine has come into her clinic and her practice. So Dr. Z, kind of like roll into that.
Okay, well, thank you, Donna. So nice to be here. Exciting to get the word out, the message. I think there's so much confusion and, not unawareness really of what is out there. And there are some effective treatments. And I've been a psychiatrist, a child psychiatrist as well, for about 15 years practicing conventionally, not getting the results that, you would want, that I wanted when I went into psychiatry. And, the typical treatments were giving, 40% remission rates at best. And then really the burden was on the therapist or the healer to augment or, add therapy, make sure that they're getting their lifestyle in order. And when I was doing that part, I realized, okay, well, that's probably the more effective part, and to really kind of focus on that. So that's kind of how Radiance started in the first place in 2017. And just kind of doing, IV nutrient therapy, importance of nutrition, diet, sleep, exercise, all those things. And then your body can heal itself, right, when given the proper nutrients. And then, people's anxiety gets better. And
isn't it so fascinating how just making some dietary changes can change mental health?
Oh,
do you see that? Yeah, I do too.
Yes.
And I don't think people realize how affected they are by the foods they eat.
Right. Well, actually, that kind of started also my sort of impetus into natural health is I was just doing a cytochrome panel testing on my patients. Someone came in saying, oh, you'll understand which medications work better on your patients if you understand their liver metabolism. So I was like, great. And so I was getting all these cytochrome, pathways analyzed. But the other test that was on this panel was this MTHFR. And I probably had about 150 patients at the time and tested all of them pretty much. And at least 80% were positive for this.
And nobody talks about MTHFR.
Nobody talks about that. Right. And then maybe in the general population, it's about a 30% mutation, but in the psychiatric populations, it's so much higher. So that made me think of the dietary things, folate issues, B12, the diet, how things are processed with those extra folates and B vitamins. So when you kind of switch to natural, change your diet, give these nutrients IV, then wow, your body can really get what it needs.
So you're doing some of the B12s in a methyl, because MTH has to do with how we methylate our B12s and our
vitamins.
And so then you're using the vitamin IV to help regulate that MTHFR. Exactly. And those B vitamins have a lot to do with our brain, B for brain, because the B12 has to do with a neuropathy and all kinds of neuro.
Even just the production of serotonin, dopamine, norepinephrine, requires B12, folate, there's almost a recipe to make up serotonin. And when you don't get the right ingredients, like you don't methylate your B vitamins, and then you have a leaky gut, you were poor absorption, then, it's a recipe for disaster. So almost IV nutrients bypasses that. So you get, B12, methylfolate right into the bloodstream, healing. People do feel better almost immediately, but really that was kind of limited to, people who are already okay, had a healthy diet, maybe more the weller people on the spectrum.
Are people that actually react to serotonin reuptake inhibitors like the Prozacs and the Zoloft. So like for that group of people, adding in that MTHFR and the B12s and things and the methylation probably was getting a better response. But then they fall into that place of people that don't respond very well, or don't respond very well to the SSRIs.
Right. Or, and then, you know, the IV nutrient maybe isn't enough, you know, enough punch. And then, you know, a lot of information on ketamine was coming out, and through the NIMH, they had like a breakthrough status that this is amazing for mental health, that suicidal thoughts vanish in seconds, you know, depression, PTSD, treatment-resistant depression. So people who've failed multiple medications and are still on medications, you know, there's hope. In record time, 2 weeks, you know, not waiting that 3 months anymore. So I was like, what? This is crazy. And then when I was looking into it, it was mainly, you know, anesthesiologists that were running these clinics, and not too many here, but maybe there was one, and all over the state. And then, whereas they're very familiar with the drug, ketamine is a, you know, old anesthetic agent, and it's been around since the 50s, and they are using it in everything, pediatric asthma to, you know, surgeries, to veterinary medicine. You know, some people come in, the stigma is, oh, it's a horse tranquilizer, but you know, no, it's, I like say they use it for animals. It's a great treatment, and they use it for children, true. And those population are, it's good for, because it's very safe. These are populations that don't communicate well and can't tell us what their issues are, or allergies or sensitivities. So you know what, just give it. It's in and out quickly, and it is effective and what it needs to be done at that time. So that's why it works. It's not because it's like some heavy duty, you know, medication.
Well, I think it's interesting too. I think it's interesting too for people to know that like what you're doing with ketamine is it's an injection that you are monitoring the patient while you're doing the injection, but the injection is actually in and out in a couple of days. Is that right?
Actually, hours. Yeah, the half-life of ketamine maybe is 2 hours. So, you know, it really almost goes in there, does its work, and then, you know, then you're halfway there. I mean, it's a huge step. Even just how you start Prozac, you know, it builds on each other, and after about 2 weeks, it starts to kick in, and then after maybe 3 months, if you're gonna notice a response, you feel it. But
boy, sometimes waiting that 3 months out, just like in practice, you know, people be got back in 2 weeks, like, I don't feel better.
Right.
Well, yeah, because it's got to get through the blood-brain barrier, and it's very difficult for these things to happen. And I think it's interesting how that ketamine has this long-term effect in the brain, despite the fact that the drug is actually no longer on board.
Right. Yes. And so they do recommend the biggest, you know, the NIMH had the study of 6 infusions in 2 weeks yielded about a 70% remission rate. And then there's definitely things that you can add in, you know, like vitamins, you know, dietary changes, even therapy, ketamine assisted therapy, that will kind of shorten or improve those remission rates to about 80-85%. So that's what we're saying and seeing. And also all the stuff at Radiance, we do, you know, float therapy, cryotherapy. We have an infrared sauna, a salt room, an oxygen bar. So when you incorporate all those kind of nutrients or biohacks, your body is going to heal pretty quickly. And so, but yeah, and I feel like the advantage of our center is that, it was me and my father who started Radiance, and he's also a retired physician, psychiatrist for many years. And so we have that kind of mental health training to help these people through their recovery. I feel like the anesthesiologists, you know, are used to just sort of cranking it up and not talking to the patients, you know, letting them be under. And it's, you know, it's a little bit of both, you know, even just all medicines. Whereas you be on some Prozac or Zoloft, you also need some, you know, therapy. To integrate and, you know, how to, you know, kind of avoid coping skills and all those kind of things, avoid, you know, pitfalls down the line. So same thing with ketamine. You want to kind of incorporate, they call it, you know, ketamine assisted therapy. And because it happens so rapidly, this progression, you know, it's almost like you don't have time to wait those 2 weeks, you know, you got to do it now.
And especially when you're looking at suicidal behavior. I mean, how many people could this help that have suicidal ideations?
Oh yeah.
When you have such a quick turnaround like that.
Yes, so many. I was even just thinking back to my you know, training in the psych ER. So many people, you know, if you had this in an emergency room setting, how life-saving could it be for people? And
you see that in the pipelines coming, do you?
You know, it is, that's a good question. I think there's a lot of controversy and, financial gain. It's a generic medication. There's, Spravato came out recently, the nasal spray from Janssen.
Janssen.
Yeah, they, and, it is taking something that's really good and with efficacy and bioavailability, IV, and then making it, less bioavailable and less robust improvements. It is still available, but it makes it very hard. You have to be on another antidepressant. You have to be on, there's lots of strict criteria where if this helps so many people, the same thing with the, what I was talking about earlier with you, the right to try. Why shouldn't someone have the right to try this medicine under medical supervision?
Yeah.
So yeah, I don't know. I think it's more, political and financial, but right, it is available. And so it's almost like you want to empower people, customers, patients to take charge of their own health, not to necessarily think just because it's, available through your insurance, it's going to be effective.
Well, yeah. And the treatment that you're doing is cash pay, because it's not one of those FDA approved type settings, like if you're getting on Prozac or you're getting on some of the oral tablets, like you're going to a regular physician to see them and get treated. And this is different. And it also, like, your success rates are really very high.
Yes. So it'd be hard for insurance to ever
talk about that a little bit, because I don't think people understand, like, first off, in my office, 80 to 90% of people coming in, underlying cause is depression. And of course, ketamine isn't for that specific group of patients, but I think what I'm speaking to there is so many people are depressed. And then we start them on medications that don't necessarily work. I think I read somewhere like 1 in 3 people have failure on the SSRIs. So that's a pretty big number, really. And so then you take that group of people, now they really feel bad because even medicine doesn't make them better. And then they feel like, what else is there? And your place of Radiance is like a hope, like, oh my gosh, there's actually something that might help me get better. And I had tons of PTSD patients that I think would, like, totally benefit from what you're doing.
Yes. Oh yeah. It's amazing, the results. I couldn't believe it either. So we started offering it. I was like, well, if we already have nurses doing the IVs. I got very familiar doing my IVs myself. I've been trained in psychiatry. Let's start doing this. And so my dad would sit in too, he was retired and he just wanted to learn. And so we were like these trip sitters and talking to these patients, and the initial treatments, amazing. They kind of really go through, processing of their life, their trauma. And then, you're kind of facilitated, got mildly, but not really, I was just observing. I was like, whoa, where is this going? And by the end, they're better. And when I was kind of looking at some of the early experiences that I've witnessed, and then the literature, they're saying it kind of helps with neuroplasticity. It's not the serotonin, it's not the dopamine or norepinephrine pathways anymore that were in the 90s and 2000s. Maybe the glutamate pathway is involved, so it's kind of a quicker or shortcut to mood enhancement. But this neuroplasticity. So I heard a great sort of analogy of ketamine and other kind of psychedelics. What it does is sort of lay, fresh powder on the slopes of your brain. So many people operate in this sort of muscle memory, and they kind of go doing the same things, behaving the same ways. And then when you sort of have the medicine on your brain, you're cleaning it out. It's like a fresh and then now you have the power to exactly, make your path. And if you want to do this and that and this, you kind of create that, and then you will follow. So that is what I like to say is so important to, understand, where you are, and provide a right set and setting, and then see where you want to go. What is your intention? Where do you want to see? And, so many people will, I don't want to feel those suicidal thoughts anymore. I don't know that dark place. And it is gone. Like it's remarkable. And we do some metric tests, so we do a full panel of assessment when the patient comes in through the guide, right? Maybe it takes about 15 minutes, and, questionnaires. And so it really gives like a nice overview of where someone lies, in terms of severity of symptoms.
Wow.
And then when we follow kind of one, so it's not so cumbersome, and the scores, gradually get better. And even if you see like a stall or a slight uptick, the third and fourth infusion, I'm not so worried, because overall that A to B, the first to the sixth infusion are, like I said, 70, 80% improved. So,
Wow.
subclinical. And then all the stuff at Radiance, like I was talking about before, the IV nutrients, float therapy, kind of doing cryotherapy, that becomes much more effective when you are sort of at your best, at your baseline.
Yeah, you said a little bit earlier about biohacking. It's kind of like biohacking the brain. What are these other services that you do? How do they help people with depression and anxiety and PTSD? And I guess probably treating people that, do you treat people that are cutters?
Yeah, especially for, in my adolescent practice, we had a lot of that. So things, and when I transitioned, that's what my focus was just mental health improvement. And later people came into me saying this is physical recovery. It was a lot of athletes and yoga instructors, and people would come to the gym, and then you're just like, you are one body, you're one person, and when your body feels good, your brain feels good, and that, so you keep going. But yeah, so float therapy is kind of where it started. And floating it was invented by John Lilly, a psychiatrist.
Is that right?
And yep, and so and it's 1,000 pounds of Epsom salt, so it's denser than the Dead Sea, and it's like ISO temperature, so it's like 95 degrees is the water. So you really lose your.
Uh-oh.
LED lights on the ceiling, so if people with kids with autism or something like that, it was a little unstable.
Yeah.
Kids with autism or something like that have want to float, and they have a sensory aversion to dark, you can still keep it on, but in general it's supposed to remove all senses, so you are just being, and people don't get to do that. They're too much distraction, and when they say about 1 hour in the float tank is like 4 hours of REM sleep.
Wow.
Yeah, so who doesn't need that restoratively? The magnesium in the Epsom salt is, used throughout our body. We have 300 reactions that need magnesium, and most people are
magnesium deficient. Yeah.
And then just that, the sensory isolation is, well, and John Lilly was taking like psychedelics in the tank and all that stuff. So kind of heightening, so having him out of body experience and then heightening with other chemicals was how he kind of created that spiritual.
So interesting.
Yes. So, and then I read tons of articles, and then also, it says to release anandamide. Like you said on your run, when you went jogging for that run, that's what you were releasing. That's what people release when they're running. And so that bliss hormone. And actually, maybe interesting. Yeah. And so that's also what it releases in the float tank. So people with PTSD, depression, anxiety, they do feel that sense of improvement by just floating once a week or even once a month after some time. The infrared sauna, is so important to just detox. Like you said, our diet is so poor. The foods are, so many preservatives. We are marinating in these toxins.
That's a good way to put it. Marinating in the toxins. Yeah. I'm reading a book right now, The Medical Medium. And he talks about eggs, how bad they are with bacteria, and he talks about dairy, and it's like, almost like, well, what in the world do we eat? Because this country has just, it's demonized the whole food. It's so bad. So I think the detox, what you're talking about, the light therapy,
yeah, so infrared kind of penetrates about 2 inches into the skin, into the body. So, and that's where our toxins are stored, in our fat, and a little bit deeper. And so when you're just kind of working out or sweating, it's very, you need to, but it's very superficial. You're just sweating to cool your body down. And when they analyze a bead of sweat from like a traditional sauna with the heat or the coals, or a workout, you're kind of getting, more water, like 98% water, maybe 2% toxins emitted. But when you're using an infrared sauna, it's going deeper, and it's not really kind of just cooling your body down, because you don't get that hot, but you're pushing out the toxins that it kind of creates that movement in your skin. So that's what's creating the sweat and then the heat. But when they analyze that bead of sweat, that has like 22% toxins and like, 80, or 78% water. So more, more detoxing of, things that you don't need in your body, and then less dehydrating. So that also very good for pain, inflammation, metabolic boost, so they say 30 minutes in there is like, can burn 600 calories.
Wow.
So, that is
I've also heard it's really good for people, like for cancer and things, like for cancer prevention. And
Yep.
Because of all that toxin that's
Yep, exactly. You're just kind of purifying your system, stopping that, right. There's toxins are what's perpetuating that tumor growth, or just that, like you said, that marinating, or I said the marinating is just not good. You want to purify the body. And then especially for the, metabolic boost, I think that's what was really hard for people with depression, is just, they know it's like a chicken and egg. I know I should exercise, I'll feel better. Or I know I should sleep, I'll feel better, but then they can't, that's the illness, and that's interfering with them. So this kind of gives them a way to kind of sit there and burn calories. And then that kind of gives them that jump start without much effort on their part.
Is there studies that say anything about that produces like an increase in serotonin, or does it like,
yes, so many things, actually more like all brain chemicals, but growth hormone. So when you kind of increase growth hormone, you have all the hormonal boosts, thyroid, estrogen, testosterone, so the whole thing. So I think that helps people get out of that funk, and especially with depression. And then just like I was saying before, with anandamide, it does have the dopamine and the norepinephrine also release. And then most people, and then cortisol decrease, which was what will help the serotonin go down, up as well.
Yeah, I did lots of stuff about, so I was also listening, is it Dr. Crystal? Is he the one that started the ketamine research?
Crystal.
Dr. Crystal. Well, anyway, I was listening to something that he was talking about, and he was talking about how these high levels of cortisol, that they're safe for us in the beginning, but the long term on the brain of having these elevated cortisol levels, and how ketamine can really help with that too. That sense of stress and doom that a lot of people have when they're really having issues with depression, like they just kind of stay in that doom, and those cortisol levels are just so whacked out.
Yeah. So, it's so hard to hear some of these things. But after ketamine, it's so amazing. They'll say like, I woke up every day with this, dread, or this thought, am I gonna do it today? Am I gonna off myself today? And then after the first infusion, she woke up, she's like, what? Where is it? When is it going to come? When's it going to come? She was up for an hour. No, like dark thoughts came, and she was just like, I can't believe this. I can't believe it. And
it seems good to be true, doesn't it?
Over and over again. And then people getting jobs, people who've been just out of work and depressed, they just, have a focus, a mission, a purpose, and then they're able to do it. And so that's what I think is so nice. It's just this, that's what people want. It's just immediate, gratification. It is really hard to kind of plan, but at the same time, you want to, give them that immediate gratification, but also tell them for the long haul, this is what you need to do. And then that just makes it much easier. I think people are more compliant that way.
Yeah. Like, so how does it work? They come in, they get an assessment, and then, you do a ketamine injection, and then how often do they have to come back to do the ketamine?
Yeah, so we, right, like you said, it's kind of not approved yet. It's off label. So we do follow the NIMH protocol, which gave the best results so far. Then Spravato had the nasal spray made by Janssen had a new protocol, and just you can't compare apples to apples, because of the blood levels, but we kind of modified it a little bit to just see if, it'll have a booster, a added effect based on what their results were. But we still give I think the main crux of the treatment is 6 infusions in 2 weeks. So if you can kind of get that in, every other day, every, 2 days, that would give you the best outcomes. And then we usually do the 7th infusion on the 3rd week, and then the 4th infusion on the 8th week. And so within a month, you're getting 8 infusions and, like I said, 80% better. If we've seen the 80% better come at the 6th infusion. And then people are kind of able to use that 7th and 8th as a maintenance, as a booster. That too is kind of new territory, new, uncharted waters. Yeah. We probably like to say, you use natural things, get off those medications, when you give your body the nutrients, it can heal itself. Mm-hmm. But there are people that have been on medicine for so long and they may need some pharmaceutical support. And so maybe monthly maintenance I've seen for people who've been on like 3 antidepressants at the same time and able to come off that. So that's not bad at all. Once a month. Amazing. And it's like an hour infusion, hour and a half at the most.
And then after that, do they come every 6 months, every year, or do they come back? Or
we have such a varied schedule, and we say, keep a finger on your kind of mood pulse, and have that rating scale that they're kind of used to taking. And if it's ever below a score that would apply to them, then to come in for that booster. And now there's all these new, because with the psych, I think it's getting a very popular treatments, and they're saying now adding more therapy can also shorten and improve the outcomes. And so we're doing some like trip journaling and having people kind of do some homework on their own to help them process this, because like the changes happen so fast.
Yeah.
Exciting.
I don't know, like I'm so fascinated with the whole thing. I think mostly because I'm so fascinated with depression and anxiety. And I think, for the longest time it had this stigma like, oh, but it's not any different than having a fatty liver or having hypertension or having any other diseases. And like this happens to be in the brain, which we kind of need.
It controls everything.
Yeah. And if we want to be happy and live a life where we wake up every day and feel like things matter, I mean, we should be doing more to help people feel better. Mm-hmm. Because then they become more productive. Then you have more people going back to work. You have like a workable society of people that actually feel like what they do helps other people. And so like trying to get people out of these, when I was in nursing school, I firsthand got to see like the treatments where they would do the electrical shocks. And I was mortified. I mean, mortified to think that they would put electrical shocks through people's brain and they would have a convulsion and then they would get up and walk to a table completely blank. And that's a treatment that's okay. But then we have ketamine, which is such a beautiful thing. And we can't even get that through. So how sad is that really? And I mean, it's that, that electrical treatment is not gone. I mean, they're still doing that.
Nope. Yep. They're still doing it. And yeah, I witnessed that too in residency. And it's so different. You hope that person's going to get better, and maybe in a month or a couple, so they enjoy that experience. I mean, it has shown great experiences, but it's not the response you get from ketamine. And even just while they're walking out the, clinic, they're just like, oh my, just a new lease on life, just so happy. So it is amazing.
A happy place to work.
Yeah, it is. It is so nice. I mean, in one hand, the rates of mental health have tripled since the pandemic. So it is hard to see in the beginning, but the success rate makes it all worth it. Definitely.
Yeah. So you were also talking about maybe in the future, you're going to be adding some other kind of therapies as well.
Yes, so ketamine, I would say, is kind of the medical model for psychedelic medicine, and that has been shown mainly in some parts of America, but mainly in Europe, as a breakthrough treatment for addictions, mental health, PTSD. We're talking about like LSD, MDMA, psilocybin from mushrooms, and same thing. They all work on that neuroplasticity. ibogaine, some of those have some very weird, ritualistic kind of violent reactions, cathartic reactions with the body, whereas ketamine is not like that at all, very controlled, safe. But yeah, that is the future. And I know, Oregon, Colorado, I think parts of California, Washington, D.C., all have kind of legalized psychedelic medicine for the treatment of mental health.
Isn't it fascinating? Like,
so
one
great.
state is like celebrating, like, let's get people better. And
yes,
I don't know.
Yes.
That sounds amazing.
So it is hopefully going to come here soon. Also, obviously that legislation process takes a long time, but there is a bill in the House to, for the right to try to treat psychedelic medicine. If you have a treatment if you have a condition that has been shown to improve with this sort of plant medicine, can I try it? Do I have the right to try it under medical supervision? Of course, I think you should.
Too. That's what I think is so interesting. I mean, I think somebody was telling me the other day about that how about the mushrooms, how maybe you can correct me, but I think she said they grow inside of a cave. And I don't know, like how she was explaining the whole plant medicine thing was so amazing. And the process of helping people heal and do spiritual journeys too. Right. And, treat depression, like what you're talking about. And it's, based on plants, which, are part of our world that we just don't even think about it. I mean, it's okay to have a cookie that comes out of a bag that's probably all, chemicals. But yet here we're using like natural things of our earth has got to oh no.
Right. I know. Is that safe? I know. It's so funny. It's so funny to see that dichotomy sometimes. But yeah, I've heard too. Well, it's, you can be growing in a cave, but you can also kind of have home grows of mushrooms. I think they should basically want to say, I guess, a dark, damp place or, cool place, like on the side, the log, a little cave. But yeah, there's so many great treatments that can come out of plant medicine.
Can you, before we got on, we were talking a little bit also about the cannabis. Are you using that, or how would that kind of fit into what the mental health? Yeah.
Yes. Yeah. Same thing, also very weird legal issues are surrounding cannabis as well. But in 2018, it became legal in Missouri for medical use. And that too I was my eyes were open to the possibilities of mental health treatment. So people were coming into my office, even before it was medically legal, using CBD, coming into Radiance using CBD. We had a CBD product on the shelf, but I didn't really know too much of it. And they were telling me they got off their SSRI, their Klonopin with CBD. And I was like, that's not possible. I've tried to get people off of Paxil. It's not easy. And I said, no way. And they said, yes. And then I was like, oh, she was just taking it for 3 months. She doesn't know. But then consistently people would say that. I was like, what? And then, too, I kind of did a lot of research and, we have in the brain and CBD, THC, CBN, all those cannabinoids, we can also get off of those antidepressants and heal. I feel like same thing. It's a plant, so it's not as powerful as someone who wants that immediate relief. But so I like to say, get to your best with ketamine, and then maintaining your progress is much easier with cannabis, especially using it all together: CBD, CBG, CBN, and THC. You do need THC, but when you're using it kind of all together, you don't really get that impairment. And you are going to just get a lot of benefits, that entourage effect, it'll work together.
Yeah, it's so interesting because I feel like that CBD world is like a roller coaster ride, because like everybody has it. It's all different brands, all different like milligrams, and like how do you decide like which one of those brands are the best? It's Yeah, because everybody's.
Yeah, it is hard. I feel like that's kind of going down that supplement, line, avenue too, that, you can get omega-3 from Costco, but you can also get it from your doctor. So, know your source and check the source. But yeah, that's unfortunate. So I definitely want to, I get a lot of questions about that too. So I am developing a kind of a professional line of cannabis or CBD, from hemp. And the other thing is people are getting these all piecemeal, like just like taking vitamin B12 and B6 and B5 or all the ones separately. Why not kind of get a cannabinoid and CBD, CBG, CBN, and then Delta 8 THC is also from hemp, but it is kind of a great, over-the-counter analog, especially when you can get it with good, quality to pain, inflammation, even insomnia. Wow. And yet you don't need, the medical card, or if it's not available, the medical is not legal in your state, you can still partake in it. So that is a great cannabinoid as well.
Well, it sounds like you have it all figured out. I feel like what a great resource. And it's so interesting because I've been a nurse since 1986, and I really just learned about it from you, meeting you at the Slim meeting. And I thought, gosh, why don't people know about these things? I mean, then I go to the office and I see so many people coming in, and you're like, they could use it, and it's so sad. I'm trying to figure out how to help people, which is kind of why this has kind of come about, is helping people see there isn't just one way. And yes, Western medicine, we need it. All those medications, they work. They have studies that prove that they do, and people do get better. But there is always the group of people that don't. Some of them need to be cleaning their gut and their eating habits. Some of them need ketamine. Some of them need vitamin and nutrients. Some of them need, the light there. It's so different for everybody. And Western medicine is just of one, this is what we use and this is how we do it. But I think, and that's good, because it's a good job, and I love doing it. But I also think sometimes we also have to think about what's going to help people feel better, be better, and get healthy, because the body, like you said, it can heal itself. Just give it the right tools to put the fire out.
Right. So exactly.
Tell people how they can find you, what your number is, where your office is. You're so delightful.
Oh, thank you. Thank you. So nice. So, yes, it's in Brentwood, Radiance. It's on the outside, it says Radiance Float and Wellness. We do have float tanks, like I said, and it's on 1760 South Brentwood Boulevard. And we have a website, www.radiancestl.com. And, you could book your appointments online as well. And what other question was you?
Is it, you got a phone number?
Oh, yes. Okay. Yeah. So 314-736-4736.
Okay. I couldn't even write it that fast. You had to say
314.
So 314.
736.
736.
4736.
4736.
Yes, all righty. Sort of a mobile phone, so you can text it and call and book, and we can help. The staff can help you there. Yeah.
Well, I love what you're doing, and I'm so inspired by talking to you today. Just thinking outside of the box, adding in all these different elements for depression, not just really concentrating on the ketamine, but adding in all these other things that really do help people mental focus. And even if you're not going to do the ketamine, can they come to your clinic to do these other things?
Right. Absolutely. That's what I kind of started with too, like a corporate wellness, how do we be better as, healers, or just, people functioning in society, and really have to take care of ourselves. And when you can, spend some time getting a float, or even we had a gym who would do their staff meeting in the salt room. So we'd all sit there breathing in the salt, talking, working, but still getting, self-care in too. So yeah, that is a great idea. That's what we kind of want to implement, because people are, if the rates of mental health have tripled, that's affecting everybody. And we can just, there are some people that need the ketamine, but then maybe you don't need that severe or heavy duty treatment, and just a good wellness routine can help too.
Do you have a monthly subscription, you can come as many times you want a month, or some kind of
Yeah, we do have some of the, like a monthly unlimited for the cryo. I think people love to do that.
What is the cryo?
So cryotherapy is a little, so it's a, kind of a chamber that you step into from the neck down. You're covered with sub-zero temperatures and blasted for 3 minutes, goes down to negative 130 degrees and maybe even colder. And but it's just sort of, what it does is it shunts your blood to your core, kind of biohacks you that you're kind of going into hypothermic shock. And once it's in your core, you're breathing and you're richly oxygenating all that blood. And then as soon as you step out, it's only 3 minutes, all that blood rushes to the extremity again, richly oxygenated. And so it's almost like great for inflammation, pain. Most people say it goes away right away. And
how long would that last?
And, kind of like a Motrin, 6 to 8 hours. So what that monthly unlimited really is great, so people would come every day, every other day, and, don't need to take kind of NSAIDs or medications. And then, after about 2 weeks or 4 weeks are much improved with their injury.
Nice.
Athletes, before and after games, LeBron James is a big cryo guy, so he'll do it before and after his game. Even just MMA fighters or people in the gym, like I was saying, those are the people who came in for recovery, is athletes, bodybuilders. It'll just sort of decrease that lactic acid buildup and improve recovery so they can go back in the gym pretty quick. But really on a mental health basis, before I knew any of the physical benefits, it was the release of, endorphins, and also anandamide, and then 2-AG. That's the other that's also the runner's high. And it's almost like when you are in there for 3 minutes, that release is equal to 500 calories. So maybe like a 10-mile run.
Wow.
And so that's what people also feel, that happiness, that giddiness, that, euphoria. So instead of, drinking and getting, that, or using drugs and getting that dopamine release and then losing that, you're not running, but you're sitting in the cryo, you're getting that dopamine release as if you were running, and kind of that builds upon your happiness, builds upon that. So kind of like, again, a biohack for happiness.
Yeah, it makes sense that would be something like that cold splash of water that you do for the parasympathetic.
Mm-hmm.
Does that kind of simmer down the sympathetic to the parasympathetic?
It would probably stimulate the paras. I would say it's more of like a shock. It would stimulate the sympathetic in the beginning, during that 3 minutes, and then you're in the parasympathetic really quick. They kind of say that it's really the chronic stress, it's that chronic low level stress that is, bad for you, that where cortisol can never go down. When you have sort of these acute stress reactions, especially if it's, safe, biohacking, those are actually good for your body in terms of building up resiliency and even modulating cortisol. So yeah, it sounds like hypothermic shock, sounds like you're being tortured, but yeah, very safe.
Does it hurt?
No, if you want to get out, you can. Most people just are shivering in there doing a little dance. But no, it doesn't hurt at all. It's cold though.
Oh, that's so interesting. Well, thank you. This has been a wonderful discussion. I've learned so much. And your enthusiasm about it is infective. Like, I'm sure listening is just like, oh, I want to meet her because you're just so alive.
Thank you.
Yeah. Well, in closing, I would just like to reintroduce Dr. Z, and her clinic is the Radiance Ketamine Clinic. And you can find her online, or you can personal book. And I think it's a fabulous way to cope with some of the depression for people, especially with PTSD, suicidal ideations, and depression that just doesn't seem to be responding. Would that be kind of a good synopsis?
Yes.
Yeah. All righty. Well, thank you, everyone. We'll see you next time. Thank you, Dr. Z.
Thanks, Donna, so much. Have a great one. Bye-bye.